Good morning, and thank you all for joining us today. Welcome to today's co-hosted webinar, Coverage Expansion for California Farm Worker Communities. My name is Marissa Montano, and I am the Director of Policy for Insure the Uninsured Project, or as many folks know us as ITEP. ITEP is co-hosting this webinar today with our friends at UC Merced, Deeringer and Associates, and the California Rural Legal Assistance Foundation. I'd also like to acknowledge before we get started that the support for the research presented today and the work that culminated in this webinar was provided by the Robert Wood Johnson Foundation's Research in Transforming Health and Healthcare Systems program, managed by Academy Health. The views expressed here do not necessarily reflect the views of the Foundation or Academy Health. Now, before we dive into the really important and exciting content we have for you today, I have some important housekeeping notes for you, recognizing that we're all Zoom pros, but we do have a few updates and things to cover before we get started. First off, this forum is being recorded and will be available on the ITEP Policy Forum webpage following the event. Attendees can listen into this webinar through their computers or by dialing in using the number and passcode provided by the Zoom software. We also welcome you to utilize the closed captioning function. So in the bottom of your screen, the CC button can enable live transcription, the live transcription feature in Zoom. If you have questions during this forum, and this is important, you don't have to wait until the end of a panel or the end of the event to submit your questions. There's a Q&A button at the bottom of your screen. You can submit questions at any point in time throughout today's event, and we encourage you to do so. If you're submitting a question for a particular panelist at any point, make sure that you just say that in your comment that is for a particular person. And again, anytime we'll take questions as we have time throughout the event. Also located at the bottom of your screen is a chat panel. Please feel free to use the chat function to say hello, chat with other attendees, share resources. We really, we want to foster some collaboration and networking and sharing of resources that you might have that aren't being presented. Also, our team at ITEP will be sharing different resources throughout the event. These will be posted on our website, but they're there for your convenience and ease throughout today's event. For those of you who are unfamiliar with ITEP, we're an over 25-year-old health policy nonprofit and convener. We have three key focus areas: coverage and access, in keeping with our original goal of ensuring the uninsured, delivery system transformation, and the future of the healthcare delivery system. To advance our policy priorities, each year ITEP hosts a variety of convenings, including the annual conference and over a dozen policy and regional working groups. We also publish in-depth issue briefs and high-level policy fact sheets throughout the year, so you can find all of this on our website. Now to kind of get into why we're here and having this event today. Throughout ITEP's annual regional working group, which we hold every year, and I hope that many of you listening have had the chance to participate in them, ITEP has heard from local stakeholders that even with the tremendous culture of coverage fostered in California, there's still extremely important communities, especially our farm worker communities across the state, that either don't have access to healthcare coverage at all, or even with the breaking down immigration barriers to Medi-Cal, and those that struggle to navigate our healthcare delivery system because of the fundamental structure of the system that just does not work for all communities. The program that we have for you today is the culmination of more than a years-long policy research project aimed at delineating and uplifting policy solutions to get farm workers covered and to address the systemic issues that ultimately drive a path forward for equity and access in healthcare for farm workers and their families. Today's program will feature a report on important data, some of which you can find in our recently published issue brief on this work, to highlight the impact of the policy solutions we're putting forward. And then we'll also have a panel of fierce advocates and community leaders to discuss one of the coverage solutions identified in our research. and that there's a current policy vehicle to leverage that solution. So before we dive into these awesome panels, I'm actually going to hand the virtual mic over to my co-moderator for today's event. It's my pleasure to introduce long-term advocate Joel Daringer of Daringer Associates. So take it away, Joel.
Hi, thanks, Marissa, and good morning, everyone. Here we have almost 200 people who've signed up for this important webinar. We've been working on this issue for quite a few years, and it's the culmination of first the UC Merced Farm Worker Health Study that was authorized by the legislature in 2018, completed last year. And then we followed up with a grant from the Robert Wood Johnson Foundation to look specifically at the health coverage issues related to farm workers. At the current point, as you'll hear, probably half the farm workers don't have health insurance. That's compared to perhaps 10% in the general population. So there's incredible equity issues to be addressed here. What we're here today to talk about is how will the current Medi-Cal expansion to remove all immigration requirements starting this coming January, how will that affect farm workers? And then to see what more can we do for the remaining uninsured farm workers at that point. So I want to thank all of the colleagues, California Rural Legal Assistance Foundation, UC Merced, and ITUP for getting us to this point. And also want to thank, without naming them, the hundreds or dozens of stakeholders who were engaged in this process through regional convenings that we had, and also 20 policymaker and stakeholder interviews that were conducted last year. So with that, I'm going to turn back to Marissa, and then Paul Brown will be presenting us with data.
Thanks, Joel. I'm going to invite Paul to come on camera and talk a little bit about the data behind our research. Paul, take it away.
Thank you. So you can all see the slides I'm sharing?
Yes.
Yep.
All right. First off, thank you to Marissa and to Joel for the introductions and for being part of this project, for leading this project really from the start. Also, I wanted to thank Nimrat Sandhu and acknowledge her. Nimrat's a graduate student here at UC Merced who's just finishing up, and she was instrumental in doing a lot of the analysis that we're going to talk about today. So there are two different types of data that we collected from this. So one is some qualitative data that we've done a series of that Joel has led, a series of discussions with regional stakeholders and with semi-structured in-depth interviews. And then the other one is analysis of a couple of different types of data sets. One is the UC Merced Farm Worker Health Study, which surveyed about 1,500 farm workers from around the state. And the other one is the NAS, the National Agricultural Workers Survey, from 2019-2020. So the interviews covered three basic topics. One is employer-based insurance, including like ways that we might go through and expand coverage through employer-based insurance. A second one is Medi-Cal expansion, and that it covered both the current expansion that's going to undocumented workers who are less than 138% of the federal poverty line, and then also discussed other types of arrangements as well, which is like, what if Medi-Cal was expanded to people with incomes under 266% of the federal poverty line? And then it also covered the Covered California expansion. So what would happen if Covered California were to be provided access, or if undocumented workers would be provided access to Covered California? So in terms of the scenarios that we looked at, we didn't really look at the employer expansion, just because the general conclusion that came out from discussions was that that's probably not the best way to go, in terms of that not much more can be done in terms of employer expansion from either a political level or just from realistic level about, you're not going to get big gains from that. So what we did is we looked at a couple of different scenarios. So we looked at, well, what do we expect to happen when Medi-Cal is expanded to undocumented workers below 138% of the federal poverty line? And we did it in two different ways. We did it, based upon the current estimates, and then also what would happen if they were able to achieve full coverage. That is, that if everyone who was eligible for Medi-Cal was able to be signed up for it. And then we also looked at what would happen if Medi-Cal was expanded to people below 66% of the federal poverty line. And then finally, we've tried to estimate what would happen if Covered California was expanded, if access to Covered California was expanded. What we're going to discuss, we're using the estimate of 348,000 farm workers at any one time. This is from the UC Berkeley Labor Center. There are various estimates out there about the number of farm workers, and the number of farm workers at any one time is not the same as the number of farm workers number of people who work in farm work at some point during the year. That's probably closer to 1 million. But we're going to use the 348 as the kind of the number to think of when we start talking about how many people have insurance and aren't going to have insurance. So first, this is what the current situation would look like. And what we've done is we've used the NAS data, and then we've double checked it with the farm worker health data and also the data from the American Community Survey to kind of come up with estimates for how many people currently have health insurance based upon their documentation status and based upon their income level. So as you can see from the top here, you have 138% below the federal poverty line, 138 to 266, and then above two incomes above 266% of the federal poverty line. And then we've looked at who has insurance and who doesn't have insurance based upon documentation status. So the current NAS estimates suggest that people who are undocumented who are below 138% of the federal poverty line, about 38% of them have insurance right now. And that for people who are documented, it's about 62%. So you notice that 62%, those are all people who in theory are eligible for Medi-Cal. So it still suggests that 38% of people who are eligible for Medi-Cal are not getting it. And that kind of drives some of the results. So if you go through and you look at the results in terms of what the numbers look like, you would sort of see is that, well, based upon those type of numbers, you would expect about 53% of all farm workers will have a health insurance. Now, when coverage is expanded to undocumented workers below 138, is that then, the thing to remember is that it's not really going to impact people above 138% of the federal poverty line. And so the question is, well, what will be the uptake for undocumented workers who are below 138% of the federal poverty line? So what we've done is we've just assumed that it's going to be the same kind of uptake as documented workers. That is that we've just sort of taken the figure here of 62% and then assume that that's what it's going to be for undocumented workers as well. So when you do that, what you see is that, well, overall, it means that 42% of undocumented workers will be estimated to have health insurance, and 72% of documented workers, which means 56% overall. So essentially, you're getting what we estimate is that there'll be about a 3% increase in coverage rates once undocumented farm workers below 138% of the federal poverty line have access to health insurance, have access to Medi-Cal. So that's not a big increase, 3%. I mean, it's good, but it's not a large increase. And I think the results are being driven by the fact that the current uptake for people who are documented below 138% of the federal poverty line is pretty low, relatively low at 62%. So the question would be, well, what would happen if everyone who was eligible to take up Medi-Cal below 138% of the federal poverty line took it up? Well, again, people above 138% are not going to be impacted. But now what we'll assume is just sort of say, okay, we'll assume that everyone then who is eligible for Medi-Cal below 138% of the federal poverty line gets it. So now your numbers go up to about 65%. So from 53 to 65%. And so you basically mean that if, under the plan that's going to go into effect is that about 12% more people, farm workers, would be able to get health insurance. The third scenario we looked at then was, well, what happens if you expand it to below 266% of the federal poverty line? So the question is, well, so what's going to be the uptake of people between 138 and 266, given that there's already a number of people, between 138 and 266 who currently have health insurance. So we just sort of assume that all those people would keep their health insurance, and that we then use the estimates from the 138% of the federal poverty line to sort of say, well, how many of the people who are left between 138 and 266 would get health insurance? And so the numbers come out kind of look like this then. We estimate that between 138 and 266, you'd end up with about 83% of the people who would get health insurance. And so overall, then you're talking about 74% of the people overall would get health insurance. And so given that, that means that you're now talking about more like a 20% increase in health insurance overall. And then the last we did is we looked to see, well, what would happen if Covered California was expanded to undocumented farm workers. So we looked at, under the current NAS data, how many people currently have insurance and where do they get their insurance from? And what you can see is that from that little chart is that relatively low numbers of people who have private insurance or employer-based insurance right now. So the question is, well, so what would happen if they were given access to Covered California? And I think the conclusion would probably be, well, if there's no increase in subsidies, then probably little impact. So without some type of subsidies, you're probably not going to have much impact. With subsidies, though, then of course the results are going to depend upon the level of subsidies that's offered. But you would sort of expect that Covered California would have some benefits over Medi-Cal. So one thing that comes out from the interview is that there is some benefit that people see from Covered California that would overcome some of the limitations of Medi-Cal. But at this point, without knowing more about the subsidy levels and about the responsiveness of people to changes in the price of insurance, it's hard to go through and kind of estimate. So in conclusion, we'd sort of say, well, the current Medi-Cal expansion to undocumented workers is unlikely to have a significant impact on coverage rates, as you're likely to see rates increase from about 53% to about 56%. If more effort was put into enrolling farm workers below 8% of the federal poverty limit, then you could get bigger increases, and the maximum would be about, if you got full employment, full coverage, is that you'd have about 65%. Expanding Medi-Cal to 266% of the federal poverty line would go through and increase it significantly, up to 73%. The cost, one thing that came out from the interviews, though, was that the cost to the state would be very significant because, if you covered all workers who are below 266 of the federal poverty line, then that would be pretty expensive. The interviews discussed the possibility that could have a farm workers only type of extension. And that has some type of merit, but also it would hit resistance if that would be introduced. And for expanding Covered California, I think it has potential to overcome some of the limitations, but the impact would depend upon the subsidy levels. And that's it.
Thank you, Paul. So I'm going to remind the audience that if you have questions for Paul, please put them in the Q&A box. But while we're waiting for others to chime in with any questions, Paul, I think I saw on some of your slides that you had this, but I know you've been thinking about this. But what is these two major options, either expanding eligibility for Medi-Cal or opening up Covered California? What's the difference in? Can you talk a little bit about what the cost to the state might be? Do you have some data to that you can kind of talk about for what that cost might be. Because I know a lot of folks, especially some of the policy focused people on the call, would be very interested in, what would this actually cost?
For Covered California or for Medi-Cal?
Can you compare both of them?
Well, I think the Medi-Cal is pretty easy to estimate because you can get Medi-Cal reimbursements to the payments to the Medi-Cal purchasers. They're available. So that one's pretty easy to estimate. And we have gone through and sort of figured out the number of extra people who would be covered and what the cost would be. For Covered California, it's a little bit more difficult because it does depend upon the subsidy levels. And it's, if you go through and you sort of say, well, suppose that the subsidy levels were full so that basically people below 266 had no type of premiums, then, you're going to be looking at the differences, that the plans are going to differ a lot between different types of counties. But, in general, the amount that's paid for an adult under Medi-Cal is $4,000, $4,500 to a Medi-Cal purchaser. So you're probably in that type of ballpark, maybe a little bit more for the Covered California.
A couple of questions have come through from the audience. The first, the 3% that you mentioned for the 3% increase in coverage with the current upcoming policy, is that for all? Is that for farm workers or for all undocumented folks under 138%?
Farm workers. So I think that different groups have different kind of coverage rates, and I think that, and Joel, you might want to speak to this, but one of the things that comes out from the interviews is some of the challenges that farm workers specifically have in terms of accessing Medi-Cal. And that's not the same for other groups. Other groups don't have the same type of barriers. So where we saw like 62% of farm workers who are eligible get Medi-Cal, and other groups it's going to be higher. So it will vary from group to group in terms of what it means for that industry.
And then another question that came through was, you mentioned some resistance to the farm worker only designation. Where's that resistance coming from?
Well, I think that, there's the question about, so what's special about farm workers? I mean, when we go through and look at the numbers of like how many people are essential workers under under COVID, there's, farm workers were one group that was essential workers, but also construction workers and also food service workers. And the list is pretty long. And you start realizing that, well, there's a lot of workers out there that would fall under the category of essential workers who, if you were going to make the case that, well, farm workers are essential workers, so therefore they should get special policy, there's other groups who I think are going to step up and say, well, wait a minute, what about us? And so I think it does get to this question about, well, are farm workers somehow more essential than other workers? And that the essential workers category is a fairly broad one in terms of what they were looking at. There is a case to be made, I think, for that there is something that's more essential about farm workers, but it is a case that has not sort of been made, vociferously at this point. At least I haven't seen it. But that is the issue, is that, can you come up with a rationale for why it is that farm workers should get a policy that's different than construction workers or someone else?
Thanks, Paul. And I think thank you for kind of hashing out some of that nuance. We do have to move along to our next panel. So Paul, thank you so much for walking us through the data. And, folks listening in, our collective group on this project, hopefully we'll be able to put your data and some of the lessons learned from the whole research project into a formal study and maybe some additional ITEP issue briefs as well. So stay tuned for more, and don't hesitate to reach out. I know someone from our ITEP team has put into the chat Paul's contact information, so please don't hesitate to reach out if you have further questions. And so with that, for our second panel, we're going to hone in on one of the policy solutions that Paul mentioned, opening up Covered California to folks, regardless of immigration status, as sort of the main topic of our final panel. So I'm going to now hand it back over to Joel, who's going to be our moderator for this panel. Thank you.
Thank you, Marissa, and thank you, Paul. We've been churning through these data and interview findings for a long time. So as many of you have seen, we put out a policy brief last month on coverage options for farm workers. A lot of the questions I saw coming through in the chat, and as Paul sort of alluded to in the data, is it's actually, a lot of it is how to make Medi-Cal work for farm workers. For those that are on it already and or eligible for it already or will become eligible for it in the coming months, how do we actually make it work? And we're going to be following up with another issue brief in the next week or so. So those of you who are on this call will certainly get notice of it, and it'll go out to the general ITUP mailing list. But as Marissa said, we're going to be shifting to a very interesting panel discussion at this point, looking at one of the options, and that has to do with opening up covered California to undocumented individuals in the state. Currently prohibited by federal law without waivers, covered California is not at all eligible for undocumented work, documented people, even if they pay, even without subsidies. So it's been an avenue that from which undocumented residents have been excluded since the beginning. But there are some avenues actually to open it up, and there's a lot of discussion going on about how to do that, so we can try and offer options for those who will not be covered by the Medi-Cal expansion. So we have 4 people on our panel today, and I'm really glad that we have such good folks. Dr. Joaquin Arambula is the assembly member from Fresno, District 31 in the state assembly, who's currently authoring the major legislative vehicle for opening up covered California. We also have Luz Gallegos, who's the executive director of TODEC, which is a community advocacy group in the Coachella Valley. Sarah Dar, who many of you may know, is the policy director for CIPC, the California Immigrant Policy Center, who's been doing a lot of work as well on Medi-Cal enrollment and barriers to enrollment. And lastly, we have Jason Levitas, who's a senior fellow at the Urban Institute, who's worked on exchange expansions, our covered California, both in Washington and Colorado, who can give us some sort of federal perspective on how to get this done. So the first one, I'm going to have each of the panelists go around for about 2 to 3 minutes and just introduce themselves and where their organization or their affiliations, and then why this topic is important and to the communities that you serve. So we'll start with Dr. Arambula and then go around the panel.
Thank you to Joel and Marissa for the invitation to speak with ITUP again. I'm pleased to be joined on the panel by so many wonderful people. I've known Sarah Dar and Luz Gallegos, as well as Jason Levitt. And the work you do with the Urban Institute, with TODEC, and with CPEN are helping our movement to advance. I'm a representative who represents half of Fresno County. I represent the cities of Fresno, Fowler, Selma, Parlier, Sanger, and Orange Cove, many unincorporated areas, a community I know well. I practiced medicine in Selma, which is the raisin capital of the world, in the emergency department for 10 years. And in that role, I saw firsthand the injustice that happens to our farm working communities when they're unable to access healthcare, when they delay care or are seeking care much later in their disease progression. It's much harder for us to keep them healthy and to keep them alive. And so I decided to do something about that and leave my practice of medicine and run for office, where we've been successfully able to work together with the grassroots efforts that you will hear from the panelists today on ways in which we can expand coverage to all, regardless of their immigration status. And so I look forward to the discussion on potential solutions, and we'll speak about AB4 and the work that we have before us, but look forward to the conversation that we can have to make a more just world.
Thank you, Assembly Member. And Luz, you're up next.
Hello, Luz Gallegos with TODEC Legal Center. TODEC, we're based out of the Coachella Valley Inland Empire, going on 40 years of community organizing and power building to elevate the realities and challenges of our most vulnerable population, which we see undocumented immigrants, especially farm workers, that do not have access to any type of privilege. We at TODEC, we truly believe that those closest to the pain should be the closest to the power. And that's why I'm so humbled to be here with all our partners here and one of our champions, Doctora Arambula, as we continue to organize and really build upon a better California for all. And we truly believe that we in California have a moral responsibility to do more for those that feed us, not only our families, our state, but the rest of the country. And as we're talking about farm workers being essential, they are the most essential workers, because without them, we wouldn't have food in our tables. So we'll continue the conversation. Thank you so much.
Thank you, Luz. And moving on to Sarah to introduce herself and CIPC.
Hi, everyone. Thank you, ITUP, and everyone for inviting me today and being here. CIPC is an immigrant rights policy advocacy organization that has worked on not only access to healthcare, but a broad set of policy proposals over many years to make sure that immigrants in California have everything they need to thrive and have access to economic mobility and be able to be treated with fairness and equity at the state level and by our state systems, while we don't hold our breath waiting for federal reform that would give them a pathway to citizenship and status that would end their exclusion from our safety net programs. Here in California, we've shown that we can create that type of inclusion and access, regardless of what's happening at the federal level. And that's been the driving philosophy behind our work on the Health for All campaign as co-sponsors with Health Access California. We've worked with Dr. Arambula and so many advocates and community members, including TODEC across the state, to advance first in the nation progress in making our Medi-Cal program available to everyone, regardless of status, and want to tackle the challenge of doing the same with our health insurance marketplace. And happy to talk more about that today.
Great. Thank you, Sarah. And Jason.
Hello, everyone. I am Jason Levitas with the Urban Institute. Urban is a think tank research organization that works to provide information to help elevate debates. I specifically work on health insurance coverage. During the Obama administration, I worked on legislation and then implementing the Affordable Care Act. My work here is brought to you by a group called State Health and Value Strategies, which is another project of the Robert Wood Johnson Foundation, which works with states, helping them with healthcare policy to support coverage and equity. And in terms of why this is important, so the way I think about it is the ACA did lots of good things to expand affordability and coverage, and I'm very happy to have done that. But one of the gaps it left in the affordability landscape is that it did not provide coverage for people who it deems not lawfully present, which are people without a federally recognized immigration status. And there is not, as Sarah suggested, probably action coming at the federal level to address that gap. And so it's great that people like you at the state level are working to address that gap, and I'm looking forward to the conversation.
Great, thank you, Jason. So let's dive into our discussion. First ask Assembly Member Arambula to talk about AB4, the legislative vehicle for opening up covered California, what its status is, and how do we think it's going to help farm workers and the remaining uninsured and undocumented residents of our state?
I'll begin, Joel, if I can, by appreciating the farm worker health study that we discussed earlier today that occurred last year, as well as the recent report that was just released that helped us to provide some data. While we can be proud of the work we're doing to expand healthcare coverage to those who are under 138% of the federal poverty level, we still have to address the affordability issues that so many undocumented Californians are facing. And so the work we're doing on AB4 is to work with Covered California to figure out how we can have a mirrored exchange to make sure that we can provide those types of supports to many of our mixed status families and undocumented Californians. I'm pleased to say that we are working closely with the administration on ways in which we can optimize a platform that can meet the needs of our communities. And it is tough work and not things that you can do overnight. And so it has become a 2-year bill so we can work closely with the administration to make sure that we implement effectively, as well as our ability to address the need for subsidies and a budget allocation that would come from that. Those are the two major discussions for us to enter into this year, and think it's important for us to both operationally get it right, that we set up the system correctly, as well as in parallel have a discussion about the need for subsidies to support that system's change. But we'll acknowledge the overall budget climate that we're facing as a state and the importance for us to continue to uplift the sacrifices and essential nature that our community members have made. I don't know how our economy would have survived if we weren't continuing to put food on the table. We ran out of paper and we ran out of many supplies, but we never ran out of food. And that was because it was our communities that continued to show up and expose themselves. And it's appropriate and equitable that as we rise out of this pandemic, that we're turning around to help those very communities that bore the brunt during the pandemic. And so I look forward to these upcoming discussions, and we'll need each one of your support and effort in this movement to continue to expand, because the work's right before us. We see that we're doing the expansions and we're still not capturing and capitalizing all those who will have the opportunity to enroll. And so we'll need those trusted messengers and community-based organizations who have relationships with our farm worker communities to be able to make sure that we are doing all we can to enroll. At some point, I'd love to talk about that next step of who's going to see them. Having been on the front lines, I know as we're expanding access that many of our regions that have geographical disparities like mine will only be exacerbated. And so look forward to parallel conversations about how we're increasing providers into communities that will be seeing many of these farm workers as well.
You're muted, Joel.
Let's see. I'm wondering if you could elaborate a little bit more on what actually are the provisions in AB4 at this point. I know it's gone through changes as we understand more about the issue, but where it is at the current time?
We took a pivot halfway through the year through some great technical assistance, both from the administration and many think tanks, some who are here on the call here today, that helped us to see the strategy change that needed to occur. Originally, the thought was to work on a 1332 waiver similar to what Washington had done. But in light of questioning who was going to be in the federal office next, or whether or not we wanted to be responsive to the federal government regarding that 1332 waiver, we looked towards the model that they're currently doing in Colorado, which is to set up a mirrored exchange. How do you have a similar exchange with similar benefits for those families who were unjustly excluded through the Affordable Care Act from being able to access services, to make sure that Covered California would be able to do it similarly to the way that Colorado did. Now, that platform establishment and ways in which we can have communication between Covered California and the mirrored really is pretty technical. and needs the administration to work with us to make sure that we're following the letter of the law while enabling as much communication cross-platform as we can. And so we're working closely with them to figure out what those next steps are, and think that's really important for us to do. But it's really about that equivalent coverage, if I can, because we have to make sure that we're not creating inadvertently a two-tiered system where one have a certain level of healthcare and others have a different level of healthcare. I'm just really cognizant that in my community, half of the parents are of mixed status families. And so if we're serious about uplifting our families in the Valley, we have to make sure that it's a policy that works for all of them, and believe that the work we're doing with the administration is very fruitful and positive and going in the right direction. They've had a legacy of leading in this space and in expanding access, and I've enjoyed working with the Newsom administration to make sure that we continue to do all that we can do to make sure that we're providing access as soon as we can. I've seen that tail end when we aren't working with the urgency that's needed, and believe that we as a state are pushing the envelope, and am grateful for all of the hard work of the advocates who have helped us to get to this point.
Great, thank you. I'm going to move on and ask Luz, as a longtime community organizer, advocate on the ground, to talk a bit about what you see as the challenges for farm workers actually getting on coverage, be it currently eligible for Medi-Cal, soon to be eligible for Medi-Cal, and what you see, what might work in opening up Covered California or mirrored exchange, what some of the challenges you might see in that.
Yes, what we continue to see on the ground, and it's not recently, it's throughout the years. We are very worried, to be honest. The majority of the farm workers that we are engaging in our outreach and education, as far as pre-enrolling into Medi-Cal, we are seeing that less and less are qualifying because of the thresholds. And that for us, it's very concerning, because all the advocacy that we have done throughout the years to really make sure that Medi-Cal expanded. Many of the farm workers, they're not going to get covered because of their income. As we know, farm workers live paycheck to paycheck, and they have to do what they need to do in order to feed their family and to keep them housed. And more, we are seeing the different impacts of work with farm workers, that they have to go out there, especially they don't have access to any safety net program or anything like that. And as we're trying to enroll them, less and less are qualifying for the Medi-Cal expansion. So right now we have an opportunity to do more as a state. We have the moral opportunity. And I want to share a picture of one of our compañeras, because for us, it's about elevating the realities of our community. And I want to share the story of Zenaida. Zenaida is a 44-year-old farm worker. She was recently diagnosed by ovarian cancer. And this happened because of COVID. She fell into the hospital. She was very ill. And there they found out that she had ovarian cancer. She had never gone to the hospital, ever. When they tried to help her enroll into the different programs, they told her that she was over the threshold. So this is something that's hurting our communities, and that's going to continue hurting our communities. And I don't know what we need to do as a state, but even our community's not thinking of prevention, they're thinking of survival. And we need to continue creating those systems that address our farm worker needs and realities. As we know, farm workers, without them, we wouldn't eat. We wouldn't have food in our tables. And as I heard Paul earlier talk about that, we need to prove that farm workers are more essential than others. What do we do when we're hungry? That is something that should have us a moral conscience. Without farm workers, we wouldn't have food on the table. We wouldn't stay healthy. So as we continue elevating the stories and realities, we need to think of those that are feeding us and are working so diligently so we could have food on the tables. And for us, it's very personal, because we hear these stories on the ground every day with the work that we do at Todec. here in the Coachella Valley and throughout the region that more and more of our farm workers are falling ill. Long COVID is hitting our communities like you wouldn't know. A lot of them are being laid off because they don't have the same mobility skills as they did prior to COVID. So this is, farm workers are continue to live very layered issues and challenges with the work and the exposure that they've been having to pesticides and so many underlying issues that they continue to have. And we need to do more. We need to do more as a state, whatever it is that we need to do, open up, cover California, but also knowing that the challenges that also could face if we don't have the subsidies in place, as we're seeing these farm workers living paycheck to paycheck and trying to make ends meet. So at this time, we are very concerned of the health and well-being of our workforce. We are seeing the ages of the gap that we're talking about that it's going to be going into implementation come 2024. Be 26 to 49, that's our working class. And we are seeing that the majority of them are not going to qualify for Medi-Cal. And what's going to happen to them when they fall sick, just like Zenaida and Maria and so many others, that we need to continue doing more. That what the federal government is not doing, we need to do it more. We need to continue pushing in the state of California.
Thank you, Luz. One of the reasons I wanted you on the panel, so we did a similar panel at the ITUP conference, is, the speaking from the heart and making the realities really known of what it is on the ground to be a low-income farm worker without health care. Maybe I was hoping you might address a little bit about sort of the low rates of current enrollment, those who are currently eligible for Medi-Cal among farm workers, which would be documented farm workers, but are still below the poverty level. And what some of the challenges you see in trying to get people to enroll for current programs, and that we're going to see even with expansions.
There's so many barriers as far as enrolling. Of course, the fear of accessing public benefits, language barriers, information, transportation. It's really going to take all of us to really engage community members and giving them the peace of mind that it's okay to access benefits, even especially those that have vulnerable situations. But it is very difficult for especially undocumented farm workers, that have an opportunity, but then have all these underlying barriers that we'll continue to face. But we believe that the solution is at the grassroots. The solution is at the grassroots, that we need to continue educating, informing, and addressing these barriers, and really addressing them from the bottom up, not from the top down, because the solution has to come from the ground. And as we continue seeing the barriers right now with the current expansions, right, with the 50 plus and 27 and under, we are seeing these barriers have been consistent throughout the years, and we don't expect them to change. But what we do fear is if they don't qualify for Medi-Cal, as we're seeing, and we have an opportunity with Covered California, I'm thinking of even putting out $200 for premiums. That's also going to be a challenge. So we have to continue thinking throughout, really addressing the pressing needs of this population, which is farm workers that lack access, that lack language barrier, because we have a lot of community members that come from indigenous communities. That's a big barrier that we have within the state of California, and here also in our region. That a lot of the publications need to be culturally conscious when we're rolling out these programs to address all these different barriers, because it's not just about income and all of that, but we need to see it in a very holistic way as we're approaching this population.
Great. Thank you, Luz. Moving on to Sarah, as one of the main advocacy groups involved in Health for All. I'm working with Dr. Arambula and the administration. What can you tell us about what you see as the future and the sort of the roadmap of the next steps in getting us over the line on this?
It's a good question, Joel. I think it's helpful to share with everyone here that, the desire and the need and the effort even to try to make our insurance marketplace also accessible and open to everyone regardless of status isn't new. When we first sort of dreamed up the Health for All campaign, the first Health for All legislation that was introduced in the state legislature in 2014 by then Senator Ricardo Lara actually proposed to make coverage in both Medi-Cal and Covered California open, regardless of status. And, that obviously we knew that was an ambitious goal. And for various reasons, including the change in presidential administration, at some point, the coalition decided to pause on the Covered California piece and focus on Medi-Cal. And the state actually rescinded its 1332 waiver that it had applied for because of the change in presidential administration and the obviously low prospects of the Trump administration approving such a waiver. But it was, evident and important to us from the beginning that all of these options be made available. And we've seen that, to Luz's point, throughout the years of working on this campaign. And, Senator Lara leaving the legislature, Dr. Arambula and Senator Marilena Durazo taking up the mantle and continuing these efforts and seeing them across the finish line on the Medi-Cal part. When we talk to impacted individuals about, their stories, about what it's like to live life undocumented and uninsured and what that looks like, and how we can bring sort of that lived experience to the fore, it has come up time and time again. We've had people share their stories about what it would mean to get Medi-Cal, and then we've also had people in our coalition say, wait, I just did the math, and my mom actually wouldn't qualify even once Medi-Cal is expanded because, her household income is just above the threshold. And we're talking about people who are still absolutely living in poverty and not able to make ends meet. And so this isn't an issue of people having too many resources such that they don't qualify for Medi-Cal. This is an issue of the Medi-Cal eligibility threshold being so low that even people who are still struggling and could by no means ever afford healthcare don't have it still. And we're talking in the order of, so we're talking about 500,000 people. The estimates, are going to vary, but 500,000 people in this state. So when we talk about even other states having made progress on this or it's amazing to see and collaborate with and interact with other states that are, advancing their own efforts on these things. And at the same time, and so much to learn from each other. And at the same time, recognizing the unique situation in California. It's the population we're talking about who'd be impacted by this type of policy change is orders of magnitude larger than in any other state. And so in order for us to just simply be responsive to the demographics of our state, it's urgent that we address this issue and tackle this challenge of this disproportionate share of the remaining uninsured that undocumented individuals make up in the state. And farm workers are a huge part of that. And also so many other folks, right? Meat packers, construction workers, domestic workers, day laborers. I mean, so many of the individuals who were deemed essential during the pandemic, like everyone has shared, are locked out, despite all of the contributions, despite all the sacrifices that they make every day, that don't go recognized, but because of the fact that they lack a set of papers. And so that was always part of the roadmap. And now we're approaching that sort of chapter or that sort of fork in the road where we've worked so hard to work on this Medi-Cal piece, and the work isn't done. To Luz's point, we still have to work on outreach and education and helping, just talking about equity. This is a community that's going to face so many myriad barriers to even, understanding what Medi-Cal is, understanding that all of a sudden, after being told, especially under the last administration, that they don't deserve anything and that they, should stay as far away from public programs as possible. Now, all of a sudden, there's been this policy change, and actually, you do qualify. You are eligible. We do want you to have healthcare. You do deserve it. You are deserving. It's a little bit of whiplash, and so there's going to be some, effort that's needed to educate folks, build up trust, reassure them that, giving their information over to the government is not going to harm them in any way, that there's no interaction with the immigration system, and then navigating the application process. I mean, things like, what's your monthly household income? I don't know, it fluctuates. I mean, my wage, depends on the hours, or, it fluctuates every week. So how do I report that? And there are ways to do it, but, that's going to require a lot of assistance. And so a lot of support is needed on that piece. But to get back to your question, Joel, the next chapter in this effort is thinking about those individuals who over the years of this campaign have told us, what if our household income is just above that threshold? We've got nowhere to go. 500,000 people we're talking about. And so that's why we came back to this effort. And, as Dr. Arambula mentioned with AB4, we've spent the last year, thanks to a lot of technical assistance from, the policy team at Covered California, and through talking to folks like Jason and other states, have determined that the best way for California to approach this is actually to take a state-based approach to creating something that looks and the experience feels the same as Covered California, but that is, a state-only, state-funded and state-only infrastructure that can provide coverage to individuals in ideally the same coverage, the same options, and eventually the same financial assistance. But that is no small feat. And so one thing I can tell you about the road ahead is that it is not going to be short. This is probably going to be a multi-year effort. And I can imagine that we might encounter some resistance or even fatigue, right? After having done, like I said, this first in the nation Medi-Cal expansion that was, billions of dollars in the state budget that have to, be allocated and accounted for in order to make sure that everyone who might qualify will be able to get that coverage. So to do the same for, again, not a small population, I'm anticipating we will be met with, some level of resistance around another big expansion. And so we just have to continue sort of, to Luz's points earlier, sounding the alarm around the urgency of this. I mean, I don't think any of us would find it acceptable to be, like Luz said, working, inordinate hours in hot sun, exposed to pesticides and smoke from wildfires, and putting our bodies on the line and having that be this reality for our family members, and then be told that we don't, we need to get in line, we can't do this right now, we've already done enough for your community, so please wait your turn, we don't have the resources. The resources do exist in the state, it's just that they're concentrated in the hands of a wealthy few. And so it's going to be up to our state leadership and advocates to push for thinking differently about our systems and our structures, and allocating resources equitably and redistributing resources equitably, so that basic things like healthcare are not something that's a luxury or a commodity that you can only afford if you can pay for it. But that's not the will to do it, I think, is one piece, and then how to achieve it, and allocating the resources in the state budget, standing up a state-based infrastructure that doesn't come up against federal restrictions or any parts of the ACA. That's going to require us to really think in the weeds on the policy piece, and that's what we're continuing to do with Dr. Arambula, with technical assistance from Covered California, and that's what we'll begin to do. And then, of course, the advocacy for the state to allocate the resources and the dollars in the state budget to both the administrative costs of setting this up, and then for eventually adding subsidies in, so that people can actually afford the coverage that's newly available to them. And I'd, happy to turn it over to other panelists, including Jason, to talk about, some of the challenges around how we can do that, some of the ways other states have done it, and what might be different for California. But I will just say this, that, it's taken a lot to get here to where we are today with the Medi-Cal expansion. It isn't easy. There are years where, because of budget constraints, we don't, make any progress on it. But I think the one thing that will see us through is, I think, being clear-eyed about the fact that it can be done. We did it with Medi-Cal, and none of the doomsday scenarios that our opponents, tried to have us believe might stand in our way came to be. And I think we can achieve those same successes. It just requires, I think, persistence and perseverance for an effort that may not be quick and easy, but with time, I think we can get there.
Great. Thank you, Sarah. I know you've also, we're not going to talk about it right now, but I know you've also been doing a lot of work on the outreach and enrollment barriers that immigrant communities are facing. And if we have time, we'll come back around to that. But you had a good segue there to Jason to talk about some of the nitty-gritty policy pieces involved in choosing whether to go with a Section 1332 waiver application or create a mirrored exchange, having worked extensively with Washington and Colorado as well. Jason gave us a great perspective. And what I'm glad is on these calls, there's a huge range of people say, who are on these ITUP calls? Well, it's a range from community people to policy wonks. So we're trying to have something for everyone on this. And Jason, you can share with us what your learnings are, what California, some of the ideas for California on expanding coverage through either a 1332 waiver or a mirrored exchange.
Well, great, thank you. And I'm very happy to fill in some of the policy wonkery. And some of this we've touched on a bit, and the speakers who came before me are clearly very I don't know if I'd say in the weeds, but are certainly well versed in all of this. But I can run through it a little bit. So right, I mean, as we've discussed, the ACA denies both marketplace subsidies, but also even the ability to enroll through the marketplace to undocumented people. But, and here's sort of the saving grace that we're working with, undocumented people can purchase the same coverage, and technically it's called individual market coverage, but you might hear it called like ACA compliant coverage. And so it has all the same protections that marketplace coverage does: no pre-existing condition exclusions, no rescissions, all the essential health benefits. So it's really the same coverage, and anyone can purchase that coverage. It's called off marketplace, and it's can be purchased in different ways, but you can buy it directly through the insurance company or other ways. But there isn't sort of a single unified convenient portal that people can go to compare plans and enroll. And there's no subsidies for that coverage. So, it's there and you can buy it. And, it's actually substantial numbers do, but it's very expensive, right? You have to pay the full premium, which can, easily be, $10,000 a year. And it varies by age and all sorts of things. So, it is, in many cases prohibitively expensive without the subsidy. So, recently, a couple of states have taken action to extend subsidized coverage through an ACA-like portal to undocumented people. And right, so there are these sort of two different approaches that states have taken, and it's Washington and Colorado. So start with Washington. So Washington has used what's called a 1332 waiver, and we've talked about this a little bit. 1332 is a section of the ACA that allows states to apply and waive some ACA rules, not all of them, but one of the rules that is waivable is this prohibition on undocumented people enrolling through the marketplace. And so under Washington's waiver, undocumented people are allowed to enroll through Washington's state-based marketplace, and then the state pays for subsidies. And subsidies, as your focus on the cost is exactly right. So in Washington, the subsidies are something like $150 per person per month, which is substantial, but not as big as the ACA subsidies are. So that's the key. That's sort of a key challenge you're going to face under both of these models. Then the Colorado model, and I think the term mirror exchange is a good way to think about it. So basically, the ACA says you can't enroll people through the marketplace, but there's no prohibition on creating, an identical looking state-based portal that anyone can use to shop for coverage, enroll in coverage, and if the state is up for providing subsidies, to subsidize this coverage. And furthermore, there can be some level of integration. It sounds like you all are already thinking about this. There can be some level of integration with the ACA marketplace where, the two of them can sort of talk to each other and help make sure people end up in the right place. You can have a similar, look and feel to your ACA marketplace. And so this is what Colorado has done. It actually has more generous subsidies. It has a public option that it's using to create some savings that it can then use to pay for the subsidies. But, money is money. But, the point here is that it has a lookalike mirror exchange where it provides state-based subsidies or state-funded subsidies to help undocumented people purchase coverage. They've had good success there. They actually ran out of money in the first year, which, isn't great, but they did, it did show good take up there. And, so in terms of, sort of how this has to look, it can be housed within a state agency. There has to be some sort of legal separation between the regular exchange and the mirror exchange, but it can share functions. And, there are rules about cost allocation between them for shared functions, et cetera. And all of that, can be, needs to be worked through. I will say I've worked with Covered California for years, including on, the premium subsidy and cost sharing subsidy that they have for ACA eligible people. And, they are very, very good at building systems and making these things work. So I would say I have a lot of faith in their ability to work these issues out. In terms of, pros and cons between the two models, I guess, the two things that have been challenging for Washington and that I think give me a little bit of pause about the 1332 approach, which not insurmountable, but, if you have to choose the two, these are the things that give me, a bit of concern. So, right, 1332, as has been discussed, is, it's a federally based program. Federal government has discretion to approve or deny any waiver, sort of for any reason that they decide upon. And, the Biden administration has been very supportive of Washington's efforts here, but there's certainly no guarantee that, every future administration would be. And so, there's, I think, that risk of whiplash there. There's also just, some additional, time and effort that goes into it. There's a lot of sort of coordination and actuarial analysis that goes along with doing a 1332 waiver. Whenever the state's going to change the amount of its subsidy, it has to sort of submit new actuarial analysis, which is all things that can be dealt with. But, it's extra work there and slows things down a bit relative to the Colorado model, where there's just more sort of state control and less oversight. I think that the last thing I flag is in terms of sort of like the privacy issue that we've talked about. So, with the Washington model, you do end up with the identifying information of the enrollees in this, federally regulated state-based marketplace. And, hopefully that's going to be okay. But I think that, that could raise some concerns. And in Colorado, the Colorado model, you're able to sort of keep it wall it off in a separate state agency or, a legally separate entity where there wouldn't be as much, federal access to that in a future potential administration. So I think those are, sort of some of the wonky details of, considerations between the two different approaches.
Right. Well, that's really helpful, Jason. And we had a question from one of the participants, and it has to do with Colorado limiting the number of people eligible enrollment to 10,000. Probably, I assume for budget reasons. But how is California looking at that, whether enrolling numbers or by poverty level? And how are they talking about rolling it out?
And I think others in California can speak to this. My understanding, Colorado didn't limit enrollment; they limited subsidies, right? They just had a certain amount of money, and so I think that again is a function of making sure you have enough money to subsidize coverage for everyone who wants it. But anyway, I'll let the California folks speak to the thinking there.
No, I think that's right. And first I'll speak about the value. When we say health for all, we mean all. And so the goal is to get us to full coverage. The question then becomes about what we can attain within any one budget year. And as we saw with the Medi-Cal expansion under 138, we had to find some priorities. We started with kids, we went to young adults, we then went to elders and seniors in the spinal population. And we'll need to have conversations with the advocates and the groups to figure out what the best way for us to roll that out. But the first step is to get it operational, to get that mirrored exchange set up so we can enroll. The second step then is the budget allocation and the enrollment and targeted populations if we need to, if we're unable to get the full budget allocation in any one budget year.
Thank you. Sarah, do you have anything to add on that?
No, I think Dr. Ramvula captured it all. We know that given the numbers, it might require thinking about incremental progress, but that's never stopped us from keeping our eye on the prize long term, even if it has to happen in phases.
There was another, unless Luz has something that you want to add on that. There was a different question, and it actually had to do with enrollment complexity. If we already face enrollment complexity in Medi-Cal, covered California in a way, you would see, how do we navigate these when we get into subsidies? How do we get into these income tax return based subsidies? Because they're advanced, at least under the federal system, they're advanced tax credits now, and at the end of the year, you figure out what your actual subsidy was. A lot of undocumented folks don't file taxes. Many do, but there's that added complexity. And maybe from what Jason was saying, it's easier than at a state level to do that, rather create a different system rather than using the federal system. But there was a concern about the complexity of the enrollment or subsidy process within the exchange.
So I can start on this. I think that's an excellent point. Is exactly right. One of the things I did in the Obama administration was working on the regulations and tax forms related to the premium tax credit, which is the main ACA subsidy for marketplace coverage, and it is very complicated. And it is absolutely right to think about the administrative burden. I think one thing, and I don't actually know what California is planning, but in Washington and Colorado, both of the subsidies there are not this sort of advanceable tax credit that then you have to file a tax return to reconcile and claim. It's a prospective subsidy where you're found eligible and then can receive it. And honestly, the enrollment process is still more complicated than we would like, but it is a lot simpler than the federal subsidy setup.
Other comments on that?
Yes, in addition to that, the tax implications, tax penalties, and all of that, but also within the farm worker community, one of the complexities or barriers that we foresee is also reporting the changes of their fluctuating income. As we know that, that could also result in penalties. So it's just more deeper when we're talking about farm workers that have fluctuating income because of harvest seasons and all of that. So that's something that we have to be in consideration of. For us, we want to make sure that all the barriers or implications that any type of rollout could potentially impact our farm worker community are well thought of, because we do see that, especially with Covered California, them constantly reporting their fluctuating income and kind of understanding all of that, all of that system is already complicated enough. That's why it's important when we're thinking of any type of policy, there has to be an investment in implementation, because without implementations, things don't become fruitful. So that's something also I want to throw out there, because we're always thinking of policy and all of that, but when the work really starts on the implementation as well.
I agree with that, and really want to uplift that, Luz, if I can. Equity is built into the last mile of implementation. and how we then work with those trusted messengers to engage with our farm workers. I'll uplift your previous comment that Latinos are not monolithic, that many of us are indigenous and speak different languages. Not everyone's literate. My grandfather never learned to read or write. And so how we create systems that ensure that we are seeing everyone who's in our state to make sure that we're adequately meeting them where they're at with whatever barriers they have will require us to do intentional outreach and to work with community groups like yours. And so I look forward to those conversations about how we can partner and bring people out of the shadows to encourage them to participate, because ultimately we have a winning story to tell about how we are there to provide assistance that is not going to affect public charge. And so I just need to be absolute about this. We as a state have worked really hard to make sure it's state-only funds, that there are no federal funds at all involved with this. So we can, with confidence, tell every Californian that these are your taxpayer dollars that you've helped to contribute that are coming back to benefiting you. And it's about time. For those of us who lived through Prop 187, who have seen what happens to our communities, it's important for us to have intentionality to make sure that we're providing those resources to our communities. But I'll just soapbox for one last second if I can. A lot of these problems could be improved if the federal government would just pass immigration reform. And unfortunately, their unwillingness leads us to create these other avenues that we are talking about today. But if we're serious about solving this at its root, I think we have to look at the fact that the federal government does not give the dignity and respect to everyone who's here in the United States.
Thank you. We're certainly open for questions. We have a few more minutes, but while we're waiting for some questions to come in, maybe we can circle back to sort of the current outreach and enrollment. Whether no matter what we do, making people eligible for a program doesn't mean they enroll, doesn't mean they use it, doesn't mean it actually achieves its purposes. So, we're talking today about making coverage available, but we've also learned that in doing that, in the recent Medi-Cal expansions, it hasn't always reached everyone. So I know, certainly Luz on the ground has worked with folks on that for a long time, and Sarah just completed a whole series of interviews and focus groups. So maybe each of you can address just some of those issues. Want me to pick one? Yes, pretty good. Luz, you go first.
I'll share with you, this is how our work looks on the ground. These are some of our team members actually going out to the fields, because we've been working very closely with all our county partners and so forth, those that are actually enrolling. But our job is to be the trusted messenger and creating the bridge. So this is one of our daily days out in the fields, informing farm workers, letting them know, and us really bridging that, and for us giving them the peace of mind. Nothing will get triggered. Information is not going to be shared with any type of homeland security or immigration or whatnot. But this is where it's at. And that's why when I talk about implementation, for us as advocates, it's not just about mobilizing, organizing, and putting pressure and educating and informing government, but the real work starts on the ground, because all that work of decades of organizing to make sure this policy gets signed, the real work starts on the ground. And that's hard for us. I always uplift implementation, because there's never a budget allocation with I haven't seen with any of our state policy that we passed pro-immigrant across the state of California throughout the years that really invest. So it really takes all of us as our moral conscience that we got this done, as we educated and informed government to get this done. Now it's our responsibility that it hits the ground. So, this is the work that we do on the daily, thanks to our volunteers, because with volunteers, we wouldn't be able to leverage. But that's where it's at. And I just wanted to share this, because this is where it's at. And I know a lot of partners across the state are, we're all vested in this, because for us, we come from farm worker background. My grandparents were braceros, my parents, myself. So we know the struggle, especially vulnerable populations like farm workers, that they give their entire working life to our state's economy to feed all of us. But when it's time for them, they don't get what they deserve. So we truly see us as an organization that our most vulnerable population, not only in the state of California, but in the entire country, are farm workers, especially those that don't have access to privilege, don't have access to safety net programs. When they are sick, they rely on their remedios because healthcare is so expensive. So we have the opportunity right now, and we've been having it as a safe net with the expansion. But now for those that don't qualify for Medi-Cal, with this opportunity that is presented, we have the opportunity to cover as many farm workers and immigrants that haven't been covered. So thank you again for this opportunity, and very hopeful and praying for all. We have lost so many lives that for us it's personal, that we make sure that every farm worker, undocumented immigrant that has been contributing to our state's economy, ag being the backbone of our state's economy, get their fair share, because they have not.
Thank you. Sarah, do you want to talk about outreach, enrollment, some best practices in actually reaching to fearful immigrant populations?
Yeah, I want to thank Luz because in the process of putting together a bunch of key informant interviews and listening sessions, Luz was one of the people we interviewed. I've really, what Luz is sharing has, like, throughout this process has been echoed by so many organizations. And believe me, we were very deliberate about talking to organizations that serve different parts of the state, that serve communities with different backgrounds, types of work and labor that they do. So farm workers were a big part of that, but there's so many other undocumented individuals who are impacted by these, expansions and potential expansions, and different communities that speak different languages. So some of the same themes are echoed across all of these lines of diversity. And some of the specifics, just to get into like the nitty gritty of what these barriers and these needs and these gaps are that we have to fill. It includes things like, what I talked about before, just understanding Medi-Cal, being able to trust that, Medi-Cal or Covered California, whatever the program is, being able to trust that they're safe to, enroll and share their information and submit an application. Some of the other barriers are, there are wonderful like CBOs set up to do enrollment assistance and provide navigation. And then there's a whole swath of community-based organizations who have the connections to these folks. I mean, like Luz said, it is no small feat to, first of all, drive long distances to reach, for in many cases, rural and far spread out communities, and then go meet people where they're at, even if that's in the fields, like the picture that Luz just shared. And so the community-based organizations that have the reach into these communities and also the trust, I mean, in many cases, their special sauce is that their staff are part of the communities themselves. So they speak the same language. Their families are impacted by the same issues. So they've built up trust that like a flyer from the Department of Healthcare Services is just not gonna be able to achieve. And so we need to support those CBOs, but then pair them with the actual enrollment assistance, because for a lot of them, they're able to educate and raise awareness about the fact that, hey, you might be eligible for this program. You should, let me talk to you about public charge and your immigration status and your information and your data privacy and all those things, and get you to the point of even wanting to apply. But then I need to do a warm handoff to the enrollment organization. And that's one of the gaps that we saw. There's a big opportunity there to try to fill those gaps by helping create those local partnerships and relationships so that people can be assisted all the way down the line, from first just knowing about this, and then actually getting some assistance to get through the application process. And then after that, navigating their coverage. What do I do with this Medi-Cal card? How do I select a plan? What does that even mean for my managed care, plan? So all of those pieces. And the same will be true if we're able to, do this work for Covered California. So some of the technical assistance, partnerships with organizations that have the expertise to help get people all the way through the process. And then support for these grassroots organizations that have figured out strategies for overcoming the key barriers that these communities face. And some of those barriers again, have already been touched upon. People don't have time off work. So the best way, a lot of these organizations told us, well, we've got a model because we had to do it during COVID. We had to go out and educate our communities, get masks out to them, help get them vaccinated. And the only way that was going to happen for folks is they can't take time off work and come in through the doors of a nonprofit organization. So we're going out to them. So it's, lack of time off work, concerns about not just immigration, but also like the financial consequences, like really getting people to understand, like, yes, Medi-Cal really is free, right? And that's not going to necessarily be the case for Covered California. So how do we talk to people about making those financial decisions? Like Luz referred to, there's been a long history of just being uninsured for people. And so that's maybe their comfort zone in a lot of cases. And so, it's some ways it's easier maybe to just think about the home remedies that I've always relied on, rather than trying to navigate this new, really complicated, sometimes unfriendly like healthcare system, and like, finding their way in that, language barriers, things that Luz talked about related to income fluctuation, and also literally geographic fluctuation. I mean, there are people who are seasonal workers, and they might move. They might move county to county, which is a challenge for Medi-Cal. It's going to be a challenge for Covered California too, because your coverage and your financial assistance is tied to like geographically where you're at. But also people even move across state lines. You might literally go work in Arizona for parts of the year. Also, county enrollment systems, and even familiarity of the county workers with unique issues for immigrant communities really impacts like the final outcome of whether someone gets covered. If the county worker that they're dealing with isn't actually aware of like what public charge is, and the fact that it doesn't apply to these people and to these state-based state-funded programs, that might be the thing that turns someone away. So those are some of the things that came up. And again, I think a lot of these community-based organizations have actually figured out how to overcome those barriers. So I think the call to action here is more support for them and more resources for them to do that work. And again, it's because the extra support and resources are needed because we've created unfair barriers, and the systems are set up to disadvantage these communities and marginalize these communities. And so in order to overcome all of those barriers, it's only fair that, there be additional attention paid and resources allocated to those that are best suited to help communities overcome those barriers.
Thank you. Thank you, Sarah. So we have about 2 minutes left. So I can give about 20 seconds each panelist to talk about, okay, so AB4 is a 2-year bill. It's going to take years to implement, may take years for subsidies. What can we do in the short term?
I'll jump in, as October 1st was National Latino Physicians Day. Currently, 6% of physicians are Latino, when 40% of our population is. It's important for us to make sure that the providers are reflective of the communities that they serve. As the first Latino physician that we've elected to statewide office in the Assembly, I think it's important for us to open up the doors for future generations. And while we can't focus on race, I hope this upcoming year we can focus on language and the importance of having providers who speak in language, both for the linguistic competency, but really the cultural competency and trust that's established when you can do that. So look forward to those discussions and all of the efforts. And again, I'm just grateful to be a part of this panel.
Thank you. Luz, closing 20 seconds. You're on mute.
I ask for your prayers. One of our members, Rosa Elena, she's an undocumented farm worker. She's in her last days, and she literally stopped working in the fields 2 weeks ago because, again, she didn't have access to healthcare. So just prayers for all of those in power, all of us organizers that are pushing, but most importantly, prayers for our most vulnerable population that does not stop working, because if they don't work, their families don't eat. Thank you.
Thanks. Jason, I'm going to go to you because I'll let Sarah, as a California person, close.
Okay, sure. Just thank you for having me. Thank you for all the important work on this. And certainly if we can be of more help, don't hesitate to reach out.
Thanks for being with us today. Sarah?
Just that, you know, I hope that for those of you that are in California, which I think is probably the majority of you, I hope you take great pride in the fact that we've been able to honestly set off a ripple effect. There's so many other states in just the last year that have done coverage expansions because they've seen the model that we have here. And so if you whether you've been a part of those efforts or not, I hope you take great pride in being a part of a state that has decided that that's important enough for us to do. And that, you know, there's a role for all of us to play, whether we're on the front lines, whether we're advocating, whether we're lawmakers, whether there's policy and technical and research assistance that we can lend to the effort, whether you've got resources to chip in. There's a role for everyone to play. And, you know, when we reach that next sort of threshold of that next win of saying we've done it again with opening up another one of our state programs and systems that we've set up in recognition that people don't have access to coverage, that, you know, that's where the ACA and the marketplace idea came from, was recognizing that this is not normal, that we have such a high uninsured rate in this country. So now we're trying to just make that equitable for everyone. I hope that when we reach that next finish line, all of you can say that, you know, you played a part in some way or another. So thank you to those that have been involved in these efforts so far, and we look forward to continuing with all of you.
Great. And I want to thank not only our panelists who've been great, but Paul and the UC Merced team, the ITUP team, without whom I can really say this would not have happened, and also Noe and the CRLA Foundation. So I'm going to turn it back to Marissa for whatever short closing she has.
Thank you to all of our esteemed panelists, not only for joining us today for the tireless work that you do on behalf of California communities. Really great conversation today. Thanks to our partners. Thanks to all of you who attended. And feel free to reach out if you have questions that we can forward on to our panelists that didn't get answered today. And have a great rest of your day. Thanks, everyone.
Thank you. Bye-bye.